In our last introductory video on palliative care, we've already talked about what the term palliative care actually means, and how the focus here is on relieving the distressing symptoms. Maybe watch that video if you haven't seen it yet. Here and now, we're going to talk about the different medical and nursing options available in the different phases of palliative care, and about the people who can support you through it. First, one thing up front, your clinical treatment team, the one that's been caring for you so far, will continue to be there for you and support you. And in addition, also specialists from the pediatric palliative team will join in. These are teams that provide outpatient care, meaning at home, including medical, nursing, and psychosocial support. They make it possible for children and young people to be cared for at home and potentially to also pass away at home. I'll talk more about these teams in the next video. You might be wondering what can be done medically, when a child or a young person has no prospect of recovery. That really depends on the situation and how the child or young person is doing. There can be phases where a child has relatively few symptoms for months or even years, but there can also be other phases or, faster progressions of the illness. So that means that palliative medicine, whether it happens in the clinic or at home, will always be tailored very individually to the current situation. Because it depends on how your child is doing and what's important now, for your child and for you. There's simply no standard roadmap for this. Instead, everything is discussed and decided with you, step by step. Initially, palliative treatment can be about preserving a good quality of life for as long as possible. To do that, treatments like chemotherapy or radiation, and sometimes even surgery, can still be used to buy time and relieve symptoms or discomfort. The goal is to choose forms of therapy that are as simple to administer and as well tolerated as possible. A factor in choosing a specific treatment can also be whether it can be done on an inpatient basis, at a day clinic, or even as an outpatient. And of course, there are other phases when things are more difficult. During these times, it's more important to manage symptoms, that is, the discomfort. For example, effectively treating pain or nausea is a key part of palliative medicine. And if your child's general condition allows, and if it can help relieve symptoms, treatments may also be suggested to alleviate things like digestive problems, difficulty with urination, or fluid buildup in the body. This includes, for example, inserting a urinary catheter or performing a puncture. But since such treatments also have side effects, it will be discussed in detail with you and your child which treatments should be performed. If the cancer progresses significantly, unpleasant symptoms or discomfort can increase. This means that, essentially, symptoms and discomfort are treated, such as pain, fever, shortness of breath, or sometimes neurological symptoms. This is done, for example, by administering appropriate medications or with a light anesthetic. Sometimes a different position in bed can already help, or aromatherapy and music therapy. The nursing team will always be by your side, so you can get reassurance about whether certain symptoms need special attention and get advice on how they can be alleviated. An important question that will also be discussed with you sooner or later is this: what medical measures should still be taken in emergency situations, And also, which ones shouldn't? Perhaps you wish for all medical options to be exhausted until the very end. Or perhaps you no longer want certain measures or certain treatments. These can be, for instance, certain treatments in the intensive care unit. All of this will be discussed with you, together, calmly, and with plenty of time. And of course, your decisions can also be changed or revoked at any time. So now, what you should know for the entire duration of the palliative treatment is that your treatment team, both in the clinic and at home, is there for you. They will accompany you throughout the whole time. It's important that you keep the conversation going, and discuss what your fears are, what your wishes are. Then, together with the doctors, you can find the treatment that best suits your child and the situation. Because palliative care is about your child and about making sure your child is getting the best possible quality of life right up until the end. What's also important is that you never have to make a decision that can't be changed later. Your situation can always change and things happen that cause you to change your mind. And that's of course okay, because your treatment team will always reevaluate together with you what you need at the moment and how you can best be supported.